Days between Memorial Day and Labor Day are considered the most dangerous time of year when it comes to traumatic injuries. With the increase, blood donations are needed more than ever. However, American Red Cross is declaring an emergency blood shortage. The national blood supply fell about 25% in June.
We need a constant supply of blood to make sure that there is enough at hospitals to go with surgeries, enough to cover accidents in the ER, enough to transfer to cancer patients or people with ongoing illnesses. The need for blood never stops.
Red Cross blood distributions to hospitals are almost 3,500 units higher per week than expected. Donors are often busy this time of year, and there are less blood drives with school being out. All these factors and more contribute to the blood shortage. Additionally, blood cannot be stockpiled because it has a limited shelf life, so donated blood is being shipped off pretty quick.